All right, my clock says noon, so we are going to get started. Welcome, everyone, to Responsible Reopening, Developing Operations and Policies for Reopening Safely. This is a webinar brought to you by the Quinlan School of Business and the Parkinson School of Health Sciences and Public Health. I'm Seth Green. I'm the founding director of the Baumhart Center at the Quinlan School of Loyola. And we are really excited for an ambitious and insightful agenda with a number of superstars, in my humble opinion, sharing their insights with you. We're going to start with our dean here at the Quinlan School, Kevin Stevens, and then we're going to turn over to the founding dean of the Parkinson School, Elaine Morato, for an overview of how to think about this COVID moment. And then we are going to move into 3 expert perspectives on how to specifically look at reopening. We're going to hear from Cheryl Scholes, the principal at Gensler, Peter Norlander, an assistant professor at Quinlan in the management department, and Pettis Kent, an assistant professor at Quinlan in the information systems. And then we're going to hopefully have a power round with your questions with the panelists. So let me turn it over now to Kevin Stevens, our dean, to welcome all of you.
Thank you, Seth. I appreciate the opportunity to speak to everyone. This is really in a very difficult moment. It turns out this is a very opportune time for Quinlan and the new Parkinson School to collaborate. We've always had in Quinlan a powerhouse HR department. In the last few years, we've really built up our logistics supply chain people. Who knew that supply chain would be the driver of everything in the universe, well, which it seems to be now. And we just founded the Parkinson School for Public Health and Allied Services. And we're lucky to have Elaine Morato, who turns out is a partner, an alumni of P&G, along with Pettis Kent, our faculty member. So the collaboration is quick and deep here. This is a unique relationship, I believe, to have collaboration between a business school and a school of public health. And so we're very fortunate to have that much intellectual firepower at Loyola University in Chicago. With no further ado, welcome, and I'll turn this over to Elaine.
Get started here with my slides real quick. And I just want to echo the welcome to you all. It is really our health resiliency is the cross-section of health and our economic resiliency. And so I'm so excited for the talk that we're going to have today, which is talking about responsible reopening. And as Seth mentioned, just a few slides I'll be sharing to set the stage. And I think we can't go further without noting that we've just met a very grave milestone in our country in terms of the number of lives that have been lost to date, just exceeding the 100,000 mark. And I just wanted to take a moment. I think it's important to remember as we think of our solutions to also remember the very human aspect, as I suspect many or some of you on our webinar with us today might have been personally affected. I was moved by this particular graphic that I saw this morning on the Washington Post, envisioning the lives lost as rays of light. And I think this is what motivates us all as we move forward, is to make sure that what we're putting into place, policies, operations, is trying to minimize impact, but also ensure that our economic resiliency can thrive as well. I've shared that what excites me about health is and working with Quinlan is the reflection that our health system, at least in the United States, is really a mosaic of interdependent actors and agencies, both public agencies as well as private. And our collective response to any health problem, particularly now COVID-19, really requires us to be able to collaborate and learn from one another. And so where are we right now, and what's the context as we start to think about reopening in the Chicago area? I just shared here a brief dashboard of local COVID statistics, talking about us as a state in Illinois, as well as a dashboard on the Chicagoland region. You know, where are we in Illinois? As many of you know, we're starting to do the bending of the curve in terms of new cases declining, which is good news, but we've also been probably hit pretty hard when you look at how we stand versus other states nationally. The dashboard, though, is showing that we're starting to move that curve from how the governor has defined the opening from a phase 2 to a phase 3. And in Chicago, starting to move also into phase 3. So what does that mean? Last time we shared with you, and we will be posting these slides, and you can link here if you haven't already seen the governor's Restore Illinois plan. Is a very staged, thoughtful progression as we go from controlling cases to actually recovery and revitalization. And so where we are moving right now, and why this talk today is so timely, is the opening of manufacturing, offices, retail, et cetera, to public in limited capacity as we implement safety precautions and think of the systems we need to have in place, as well as HR components. Last week, we brought in experts who talked with us about what I might call testing 101 or literacy. And talking about the components that are necessary to, as part of a vibrant system, and that is testing of COVID. How does what we do in a workplace setting compare and relate to the public health setting? We're not talking that today. Today we're talking about, so what do you do about it in a work site? But if you're wanting to get your 101, you can go to the Quinlan site and get a briefer there on the slides that we shared. I'm going to share a couple of sources that are from public health, one being from OSHA, Occupational Safety and Health Administration. And this report is basic guidance on preparing workplaces for COVID. And I just give here the highlights, that steps all employers can take. We'll be hearing detail, as I said, on how to operationalize it. But it's thinking in your own work site, developing an infectious disease preparedness and response plan that takes into account what we know will be increased worker absenteeism, physical requirements, social distancing and behaviors, and other anticipation of interrupted supply chains for our own work. Basic infection prevention methods at our work sites, which include hygiene, disinfecting workplaces, as well as just thinking about masks and air circulation that affects transmission. Developing policies and procedures for prompt identification and isolation of sick people or employees. And that's where the coordination with local public health departments is so critical. And thinking about, as we were getting ready to talk with you, implementing communication plans and really being flexible and adaptable, and how we might need to scale up or scale down depending on the information that we're receiving both within a work site as well as externally. So this plan here takes you through nuts and bolts. We're fortunate in the Chicago area that our mayor has been working on plans and more detail that breaks it down by industry. I list here links that if you're in education and childcare, office, you can read the list. A variety of now starting to say, how do you take these general guidances and start to tailor them for your local work setting? I think what's particularly exciting for us here in Chicago is that this is an opportunity for us to think about certifying in the context of risk management. People want to know that they're feeling safe. It's not to say that we're taking away all risk as we work through this epidemic together, but are we taking prudent and practical approaches to try to minimize risk as best we can? So these are great resources, and I'm going to stop now with some pearls of wisdom before turning it over to my colleagues who will say, how do we operationalize this and think of policies and work sites? So some public health pearls of wisdom as we move forward is to remember we're entering what might be called a fifth stage of coronavirus grief, and that's acceptance. So while we're very happy that cases are going down, the virus is still here and still staying. And the question is how do we now live with it safely? And how do we reimagine what our work sites should be as we work through this and build collective immunity together, regardless of whether or not it's through an immunization, vaccine, or other means. And to be reminded by our mayor that reopening could lead to reclosing if we're not thoughtful about these processes as we move forward. And so with that, I'm going to turn it back over to Seth, who will bring in the experts that we've convened here with you to help bring some real world solutions to your needs. Thank you. And you're taking it back, Seth?
Thank you so much, Dean Murado. And I want to now turn over to one of those experts, because you really set the table beautifully by talking about the complexity of this moment, and that there are steps we can be taking to be ready, even if not fully, riskless. And one of the leaders in global architecture and design net large, as well as meeting this moment with a lot of advice for workplaces, is Gensler. And we are thrilled to have Cheryl Scholes, who is a principal at Gensler and one of the leaders of the Chicago, and actually nationally, one of the leaders of the firm. And so, Cheryl, let me turn it over to you. We're eager to hear your insights on this topic.
Thank you, Seth. Good afternoon, everybody. Again, Cheryl Scholes. I work for Gensler. For those of you that don't know, Gensler is a global architecture firm, diversified in a number of different practice areas, and we're all looking at how we're going to tackle COVID-19 and help everyone to the other side with everyone's help. So today's presentation, and I told Seth I would try and keep it under 10. Normally this goes for a good hour because there's so much to dig into. But we're going to talk about the return to office today, and what does that mean? So we all know, and Elaine, you just mentioned, we're all going to be possibly returning, starting probably in staggered phases as early as, the next couple of weeks. So what does that mean? And what's been keeping you up at night? Next. So there are definite immediate actions. What are our office buildings, tenant spaces going to look like day one in the middle of an ongoing pandemic? And how are we going to reimagine our future? Because whatever we're going to start to develop and look into today will have legs that will carry into the future. And how do we do that thoughtfully? Next. So we have been talking to our clients nonstop in the US for well over 10 weeks. We've also been talking to our colleagues in Greater China who have been through this. They're already back at work, so we're taking some of our cues from them. But I think if you look at some of the thought bubbles here, we really know that health and wellness is a priority, not just now, but for the future. That there will be no end to this. In fact, it's going to be on an accelerated course. We all know that virtual is not real, recorded is not live, and that we are craving and need the human experience. Most of all, and this plays into what Elaine said too, it's, how we're going to communicate the changes that need to be initiated. Communication is going to be key. We've heard of test, test, test. It's going to be communicate, communicate, communicate. No over communication. And then we also know that through looking at all of this, that home is not the office. We tried, it's been 10 weeks. We're all anxious to get back. Next. So at Gensler, we recently conducted a work from home survey with over 2,300 responses. There is a detail to this that I'm happy to share, but basically these are the highlights. Through the response of the survey, we know that 70%, the majority of people, want to return to the office. 30% of those want a flexible work arrangement where they're going into the office and will continue to work at home. And you will find that that is based on a demographic. We're finding that our millennials, younger folks are finding it hard to concentrate at home. They're feeling a lack of connection. The more mature crowd, the baby boomers, they're kind of loving this. They're getting their focus time. They're adapting to this more so than others. Next. But in terms of returning to the office, what are people looking for? Look at the four top line items, okay? Scheduled meetings with colleagues. We can Zoom and go to all day, but really we want that human face-to-face connection, interaction. The socialization, the impromptu FaceTime. We're living back-to-back on calls. We just can't walk by somebody's desk or walk down the aisle and go, oh, yep, I meant to ask that person something. Everything is hyper-scheduled right now. And we want to be part of a community. We're missing all of that right now. But if you look at items 5 through 9, especially number 9, access to amenities. Amenities used to be a differentiator in an office building. You wanted to be in this building because it offered X, Y, and Z. Amenities aren't necessarily going to be open day one. They will eventually. But right now, people are more interested in the health and wellness perspective of a building in order to come back. Next. So a few more stats here. 74% say the people are what they miss most. 55% say collaborating with others is harder at home. I contest to that. Working at Gensler, an architectural firm, where we are constantly working and looking at drawings, you know, based on what we're working at home and the size of our monitors, you know, that gets to be a little bit challenging. And then 51% saying staying up to date on what others is working on is harder at home. Next. So when we start to look at all of this, we started to look at all the different components and pieces. How do we communicate change? What needs to change? And we started to look at developing a playbook for clients with their input. So the new workplace, significant changes are coming. We're going to have reconfiguration of workstations. You're going to see a lot of plexiglass. You're going to see more hand sanitizer than you probably ever knew was possible out there. All of these changes will be incorporated in the workplace in the next few weeks. Next. So there are 6 levers here that are emerging design strategies. Everyone is very much interested in indoor air quality. How are we going to change that? How are we going to adapt health screening systems within spaces? Voice automation and activation. You've already seen a lot of this. You're going to be seeing more of it, the kind of the touchless environment. Hygiene protocols are going to be kicked way up. Learning from healthcare. There is an incredible amount that we are learning from healthcare. How much of that do we take into the office? And then rethinking office design, kind of the reconfiguration of parts and pieces, and what are we going to do when we get there that we didn't do before. Next. So we have a number of topics here. I will just touch on some of these. Building entries. Going back to work, you should already be in contact, or your office management team should be in contact with your building to know how you're going to arrive. We can't have everyone arriving at the same time. There will be staggered levels of arrival and departure. Very important. While looking at this very lovely lobby on the left here, the one thing we don't want it to look like is a TSA line at the airport with just hordes of people, long wait times. It's going to be a choreographed dance, if you will, coming back to the office. Visitor check-in, you're going to see more technology than ever before. Many buildings now have this, where if you're going to a tenant's space, you're going to visit a client, you're going to get an invitation. When you accept that invitation, you're going to get a QR code that will take you through the lobby. You're going to scan that at the security turnstile, which then will take you and advise you to which elevator cab, most likely destination dispatch, if it doesn't exist already, that'll take you to your arrival floor. Seamlessly, expeditiously, not necessarily the need to interface with others at a typical concierge or guest registration. Health and guest screening, you know, the debate's out. Some people want the tenants to monitor this. Other tenants want the office building managers to take this responsibility on. It's going to be a case-by-case, building-by-building decision. Vertical transportation, again, those staggered arrival times that you're going to need to adhere to. At departure times as well. You know, in some cases, depending on the building and the size of the cab, you may only have 2 people going up at a time in a cab. So what does that do to wait times? Companies are looking at shifts. Some people are looking to return to work to, you know, be past Labor Day. So we're going to learn a lot in the next few weeks to see how these things change. Next. Infrastructure, in terms of mechanical, more air flush, more you know, airflow in buildings, higher level of filter changes, perhaps an upgraded filter change. Core restrooms, you know, initially you're probably going to be only using every other sink. In the future, if you don't have touchless faucets and hand soap dispensers, you probably will be adding those. We're looking at taking all the interfaces, you know, the key pin entries to restrooms away. It might be a swipe of your smartphone to enter a restroom. In terms of food service, for now, it's going to be grab and go. You won't be seeing the salad bars, make your own salad, as I'm sure you probably all expect. It'll be grab and go, most likely too. You will be also ordering your lunch, your coffee, everything off a technology-based app and picking it up. Conferencing, you'll see a higher level of technology interface. Some of you might recall telepresence from years ago. Technology has come a long way. You're going to see rooms, maybe not scaled as largely, They will have a reduction in the number of seats, but you're going to see larger video walls and ways to communicate people, because some people will still be working from home. Next. You've got visitor centers and fitnesses, and I mentioned earlier, fitness amenities will not be open day one. In terms of fitness centers, what we will be having are spaced out equipment. All of the handheld equipment probably will be put away, the hand weights, free weights, things of that nature. A much higher level of sanitation will be required. And outdoor space, we certainly can't get enough of it. Whether it's a new build or an existing build, we see much more real estate being repurposed to be have that outdoor feel. Next. So through all of this, we're helping folks define a vision. We know that we need clear communications. We know that there will be operational impacts. There will be building improvements, and Lord, I hope, occupant behavioral changes. That's really the key to all of this. Next. So, whether you are a tenant, whether you're a building owner, asset manager, whether you're a company that has a global platform real estate portfolio, you're going to want to be able to communicate a number of different things. How you're going to enter a building, what are the changes to the mechanical systems in the building, what's going to be happening in terms of signage and wayfinding. So what we do is we work together and we look at each of these tiles, and behind each of these tiles, it's a bit of an interactive PDF. You'll be able to click on it and get all of the relevant information that you need. Next. So within this playbook, there are a number of different things, of ways that you can communicate to people. Again, all referencing some of the tiles that were on the previous slide. And basically what we do is we leverage a lot of this information, and there is an incredible amount of information out there. We're referencing the CDC, we're referencing OSHA, we're referencing a number of entities. And the one thing that through all of this is, in the work that we do, we are not the mechanical plumbing experts. We are not the industrial hygienists. We're not the vertical transportation consultants, but we are working with all of these folks to come and combine knowledge that will be fruitful and beneficial and successful and make people feel safe when they return to the office. Next. So a bit of coming attractions. Our education team is launching on a return to campus offering, which will be out, I believe, by tomorrow. We're happy to share all of that with you. Next. And then some of the other Gensler resources. A lot of this information is just a click away. Don't want this to be an advertisement, but we have done a lot of research, and it's all there for you to look at and learn from and take with you in all the work that you're doing as you're preparing for your return to work. Thank you.
Thank you so much, Cheryl, for a truly insightful and visionary presentation of how we're going to see changes in the future. I'm reminded of that quote, crisis is the parent of invention, because, so many of the things that you described in terms of being able to be on your phone and order all these things and get into a bathroom without having those dirty, buttons you have to click on are things we probably want anyway, but now obviously they are being accelerated because the moment is calling for them at a much different level of urgency. So we're very grateful to have your advice in terms of how we can design for that future. And it's a perfect segue because you've really laid out the broad reasons people want to come back, and then the physical aspects of the workplace and how to think about the actual workplace. We're now going to turn over to Peter Norlander, who is a leader in human resources management and who thinks a lot about the people in that workplace and the HR policies that folks are going to need to be thoughtful about as they return to this environment. Peter, let me make sure that you are, let me unmute you here. Peter, I'll turn it over to you.
Thank you very much, Seth, and thank you for the presentations earlier. So I want to begin with as a thought is that for those of you who are in human resources, or if you have a human resources department, you've interacted with human resources, you can and should trust your training, trust your people. So if Seth, you can go to the next, let you know that the existing routines, policies, and procedures you have in place are the first place you should go when questions arise, and you should expect questions and an acceleration of those HR questions. So typical policies around attendance and leave may come up on a monthly or quarterly basis at a certain volume. Expect those to increase during this time, and be prepared to answer and address employee issues proactively in this moment. So there isn't a one-size-fits-all, and I'm glad that we saw that there are industry-specific recommendations, general recommendations for every workplace, but there's also going to be a specific context that you and your workers are in. And so you have the ability to get your resources in line so that you can contact experts in facilities, building management, experts in employment and labor law, experts in human resources, policies and procedures at your company. Make sure they're prepared. Stick to, and there have been some changes, I'll go over a few, in government policies, but stick to the hand guides and the materials that are on these government websites. There's a lot of new information out there. There's a lot of bad and misinformation too. Next slide, please. I want to also encourage you, you already have your company's values and history and legacy, and that's unique. And so what happens in this moment will leave an imprint on the future. And so I cartoonishly put up the notion of heroes and maybe stories coming out of this. Employees and people remember their families, their communities are impacted by how you address the situation. So your values and your leadership will help establish a sense of justice, integrity, and balancing that efficiency as you reopen. Next slide, please. So I want to cover some key policies and regulations, and my main thought here is not to alarm you with a bunch of radical changes. It's to emphasize that the same standards and laws that were in place before COVID are in place now, and the context has changed. In addition, there are some new policies and a new context. So I'm going to go through the highlights here. I am not an employment or labor lawyer, but if you're in human resources, the event, and so some of these may come up in your workplace or not, but you should be aware of what occupational safety and health, OSHA, as we've heard about, provides employers a duty to provide workers a safe workplace, and it requires.
And Peter, we're having occasional challenge with your sound, so I'm just taking off your video. That often fixes it, so just so you know.
Apologies for that. So there's a bunch of information on the OSHA website as well. So in terms of other areas, is that better, Seth? Can you hear me better now?
I think so. Keep going. We'll let you know if we have anything else, but let's assume that we're fixed.
Well, I wish we were together. Let's go to the next slide, and I want to cover these at a high level. And I also should say, you as an employer may be exempt from some of these rules. Your employer size may have an impact as well. So when it comes to the Family and Medical Leave Act requiring unpaid leave, the Fair Labor Standards Act, if there are any challenges with employment classification and workers working additional hours, that may come up as well. And then the Department of Labor also has a federal WARN law requiring notification in the event of a layoff in certain cases. Next slide, please.
Peter, we don't hear you right now.
That's a so the next thought is on equal employment opportunity. They requires not discriminate on the basis of race, color, religion, national origin, age over 40, and so forth, and to prevent harassment in the workplace, including hostile work environment harassment. So the Americans with Disabilities Act requires accommodations, and these would require employment law expertise or HR expertise if any employees feels discriminated or harassed in the workplace to address immediately. Next slide, please. Okay, and the National Labor Relations Act, even if you are in a non-union work environment, does cover your employees. Typically, your workers have a right to form a union. They have a right to voice concern in place. is protected when workers form together, and if they voice concerns on social media, retaliation is prohibited. So a few employers have been in the news, these types of issues. It's an important area to be aware of as a potential issue. Next slide, please. Okay, so there are some new laws as well. If you're an employer with over 50 or under 100 employees, there's a paid leave entitlement. The federal government provides support for the funding of this program. But if workers are sick or quarantined, there's a paid leave program. There's also, as many are aware, pandemic unemployment, $100 a week, and their ability of doing that in combination with furloughs. Now, just to emphasize this here, that your company's standards and procedures also apply. If you have policies that you practice in place, it's not the time to change all of your policies. Now is the time to apply them at a more rapid pace and figure out where are you going to flex and where you're going to hold the line. Next slide, please. Okay, so a few examples here of new contexts and the same standards. So when it comes to an employee who needs or requests a reasonable accommodation, is the worker unable to perform their job duties due to a major life activity due to a disability? Would an accommodation help address the issue, or would it pose the employer an undue hardship? You need to apply judgment in this circumstance. So looking at the work and looking at the individual, you have managerial discretion, or do you have HR oversight of this process? What do you have on hand? Can this person, for example, continue to work from home? Can their job duties be changed and they come to work? Is there a labor pool that you have and you have a furlough or other policy? But these policies should be applied consistently and fairly. Another example, if you're recalling workers who've been laid off, typically unemployed workers are ineligible for benefits if they have a job offer. So that raises a lot of concerns about the $600 a week additional unemployment assistance for workers. But in the new context, employers can institute bona fide work sharing programs that have to be certified with the state Department of Employment Security. And there's a way that you can reduce employer hours, employer costs, and maintain workers' income through unemployment assistance, sharing the cost of wages. So these are some new policies. Next slide. So just a few reminders, and I'm glad that Cheryl mentioned communication as being so key. You've got this, and your HR practices are essential to making employees buy into all of the activities that they must take. So your context and your group's concerns are going to be key drivers of the response. And what I'd say is that, you know, change here is going to be part of this as well. So you have to be flexible. Things do change rapidly. And you can go to the next slide. And you'll need to educate workers. So OSHA.gov has posters. Department of Labor has new posters as well. Present the data to your workers, tap into your authority, and rely on those government resources from the city of Chicago, state of Illinois, and the federal government. Next slide. And another opportunity here is to really involve workers. These workers want to have a safe workplace too. So putting the question to the workers, they will have good ideas. And there are ways that participation is essential to maintaining a safe workplace. It's not enough to just have, for example, clean facilities, disinfecting the workplace. What can workers do every day to make sure the work is as safe as possible? So thank you very much, and I apologize for the sound difficulties. Look forward to any questions. Thank you.
Great. Thank you so much, Peter. And it ended up coming out great. My only regret is that you were wearing a very smart tie, so it reinforced the intelligence of the presentation, but I imagine our guests can imagine that. We're going to turn over now, speaking of smart presentations, to Pettis Kent, who is going to move us now from the people side to the operations side and take us through the operations necessary to responsibly reopen. Pettis?
All right, thank you, Seth, and it's good to be with you. We can go to the next slide. I just want to go over a couple of reminders as we think about operations, both from a service standpoint and a manufacturing standpoint, just some characteristics and some challenges. But first, I wanted to start with this mission that when I think of a firm reopening, and perhaps this should be part of their mission anyway, but to create and deliver quality products and services in a profitable manner while maintaining the health and safety of employees and customers should be paramount. And I think perhaps that second part of this mission is going to be put even under a bigger microscope now with the pandemic. And so as I take us through the next few slides, I'll just talk about the differences I see between reopening from a services standpoint, operations standpoint, and a manufacturing standpoint. So next, please. Next. So many of you may know this, but we largely live in a services economy in the US. Actually, for probably the last 40 years or so, services generate 77% of our gross domestic product and accounts for about 80% of our jobs. Over 50% of our business-to-business spending is on services. And the US is the largest trader of services in the world with over 1 trillion of two-way traded services. And a trend that's been happening over the last several years is in 2019, services produced a trade surplus of 250 billion against a goods trade deficit of 866 billion, meaning we are exporting more services than we're bringing in, and we are importing more goods than we're sending out. Next, please. And so let me talk about a couple of characteristics and challenges when we think of service operations as opposed to manufacturing. So for services, we have customer participation. The customer is present in the service process, whether it's a hair salon or getting your nails done or what have you. That customer is there while the product or the service is being created. You can't separate the two. And again, in the next slide, I'll talk about exceptions, but for largely, this is kind of what we see. Simultaneity. Services are often created and consumed simultaneously. So going back to the hair salon or the nail salon or the spa, the services being created and consumed simultaneously. You can't get your nails done without being there in the salon getting them done. So that creates some complications. Perishability. A service is a perishable commodity. Think about an airline seat, empty airline seat, or unoccupied hotel room. Once that plane takes off, the airline cannot get revenue from that seat. It's gone. They may be able to find other ways to make it up, but at least that revenue has left. If they can't rent the hotel room last night, then they've lost that revenue forever. Again, they may find other ways to make it up, but they've lost it. So there's a perishability factor, unlike products that are manufactured that have a longer shelf life. Intangibility. Some services are ideas and concepts and therefore difficult to patent. And on top of that, there's this heterogeneity feature of services where, due to its intangible nature as well as customer involvement, there can be significant variance. If I go to the Subway sandwich store and I am waiting in line, I'm ordering my roasted chicken sandwich like I often did when I'm at Quinlan. The person in front of me may order it with the same sandwich with the works. I will order it with just lettuce and light mayonnaise. And so the variance between customers drives difficulty into the delivery of services. And that's even without the idea around this pandemic bringing more challenges. And then lastly, the non-transferable ownership. Customers may gain access to assets, but never take ownership of them. So go back to the airline example or the hotel example. You may be able to rent that airline seat for your flight or rent that hotel room for your stay, but you do not gain ownership of it. And so that's a unique characteristic of services. Next. There are some exceptions. Knowledge service providers specifically come to mind. So academia, accountants, lawyers, investment advisors, other types. Even though, like Cheryl mentioned, I think the best delivery of this service tends to be intimate and face-to-face. We are able to, in the knowledge service business, be able to create and transfer knowledge to customers via technology, be it video conferencing, recordings, websites, email, telephone, etc. we are able to deliver a quality product without being in the same room. Again, we would much rather be closer and more intimate, but this is at least something to consider when we're thinking about operations. We have a little bit more flexibility. I'm teaching a class right now online that was planned as an online class from the beginning of the school year because we have a student from University of Dallas joining, for example. And so that allows the flexibility, unlike a hair salon or what have you. Next, please. So I wanted to just give a couple of policy change examples. I thought about a big business as well as a small business, just to give you some ideas. I think, like was mentioned previously, I think there will be some consistent threads in terms of policy changes, and from an operational standpoint, masks, I think, will be a consistent thing that we see. But for Delta Airlines, they've come up with a way to do electrostatic spraying to sanitize their aircrafts between flights. Boarding from back to front, limited to 10 customers at a time to limit congestion. 60% capacities with no middle seats on flights. Recirculating air 10 to 30 times per hour with fresh outside air. And then snack bags given to customers when they board so that we can keep the flight crews out of the aisle during the flight. Next, please. I chose a small business, so I spent time in Cincinnati, and I still get email notifications from barbershops and hair salons that I was associated with in the past. And so recently they opened about 2 weeks ago, and this was some of the these were some of the new directives in their policies. So a couple of things that highlight: servicing one client at a time. They wanted to reduce the congestion in a hair salon or a barbershop, and there's usually a lot of loitering about. They said, okay, one client at a time. You must wait in your car until you are asked to come in. Kids will not be allowed. You'll have to sign a waiver as well as your service provider will, and then come to the appointments alone. And so what's interesting about services is based on the service you're providing, the policy changes to your operations may sound a lot different. This sounds a lot different than what Delta's doing, even though there's some overlap. Next, please. Next. If we think about manufacturing operations, for sure there are definitely challenges. There was a survey and report done by PricewaterhouseCoopers, and it talked about a number of challenges facing the manufacturing in this during this pandemic. Even though 80% of the jobs in the U.S. are service jobs, there's still around 13 million manufacturing jobs, and many of them cannot be done remotely. This has definitely depressed the business from an economic standpoint, and it's made it tougher for manufacturers to meet their debt obligations and keep their cash flow. And so some of the government programs have helped, but they've also thought about ways that they can become more efficient. So now you're seeing firms implement more automation to reduce risks of outbreaks, also considering outsourcing non-essential functions like IT or legal for other firms. Next, please. And so when Forbes did a poll of manufacturers, it was interesting to see how consistent the changes were, the policy changes. So in contrast to how I showed the policy changes in two different service settings, it is interesting to see that a lot of the changes that were being recommended for manufacturing operations were consistent, largely because they don't have the customer to consider. It's mainly about the employees. So 88% of the non-essential employees will be working from home. Health screening prior to the start of shifts with thermometer scans of arriving employees. Manufacturers offering additional paid time off days to encourage employees to self-isolate. Enforcing safe distancing on factory floors, and then also distributing the work across different shifts. Everything doesn't have to be done in the second shift. Some work can be done, and some employees can exist in the first or third shift. And then implementing sanitation procedures, which I think is pretty standard no matter what type of business you're in. And I think it's important to remember that a lot of these policies I think will be codified into the SOPs, the standard operating procedures, and will likely become permanent even after we get over the hump with the pandemic, because a lot of these are common sense changes. Next, please. And so as I think of a bottom line, I do think that clearly service, whether you're in services or manufacturing, you're going to have to rethink your operational strategy. I think the change to the manufacturing operational strategy tends to be a little bit easier or a little bit more straightforward because the customer is not as involved with the product creation and delivery. The firms that are creative and stay true to that original mission that I talked about will likely be the ones still standing. And hopefully there is a vaccine and treatment options that will help quicken the recovery. But like I mentioned in the last slide, I think a lot of the operational changes being created and implemented will likely remain.
Dennis, thank you so much for your insights. And I have to just say, I am so grateful constantly to work at Loyola alongside such incredible colleagues, and yours and Peter's presentation, and then hearing Gensler's global insights has been truly phenomenal. And we are now going to have the opportunity to have some questions for all of you, as well as Dean Stevens and Murado. And I want to start with a question that's in our chat that I think is applicable to all of you, which is around how should leaders engage their teams around how to prepare for the return to work. It sounds like there are a lot of global recommendations out there, but something that Peter mentioned specifically, and that I think was a thread in everyone's comments, is that engagement with your teams and having their ownership in the process is really key. It speaks, Cheryl, to your points about, people want to return to work for specific reasons. It's not the amenities, as it turns out. It's really these human connections. And so we'll open this one up to anyone who wants to start. But, how would you recommend you engage your teams around this return to work and getting ready for the new normal?
I'm happy to lead off with this one, Seth. I think, it's a team effort, right? It's the only way we're all going to make it to the other side successfully, is that you need everybody on board. So you need communication, you need dialogue with them. Depending on the size of your organization, this could be within a Zoom focus group or go-to focus group. But there are employee surveys out there that can be generated and tooled for your organization that can kind of understand what people are concerned about, what they're looking to see when they return, and what they're willing to do. And then it kind of sets a framework of how you're going to deliver a rollout based on that.
Thanks, Cheryl. Other panelists?
Sure, this is Pete here, and I would suggest starting with open communication and conversation. So for example, one-on-ones, have the management leadership team contact everyone personally and say, I'm here to talk, let's have a conversation. In terms of survey solutions or focus groups, you may want to convene particular groups to hear their concerns or survey your workforce. I can suggest a free resource here. Qualtrics is an excellent survey research company, and they have provided some free resources on, for example, doing a remote worker survey or a return to work survey. Those, typically pricey survey solutions they're putting out there for anyone to use.
Yeah. This is Elaine. I'll just add in maybe some 101 that comes from communication in public health crises as leaders. It's okay to say we don't have all answers. Credible leaders say, here's what we know and here's what we don't know. But what we do know is that behaviors are things that we can do that reduce the risk. And so many of the actions that you've just heard from the other speakers speak to that. And so how do we come together to be creative in how we go about implementing behaviors that we can control? And we will, as leaders, continue to be adaptive and paying attention and monitoring the world around us and be flexible. So, modeling that spirit that, we're going to use wisdom of outside forces or knowledge, but we're going to adapt it for resilience within things that we can control. And frankly, what each of you do at your own local site is role modeling to the collective good as well. And so I think that's how leaders are also role models for others.
This is Kevin. If I can segue off what Elaine said, one of the most helpful things I found is talking to my colleagues at the other Jesuit universities. There are 27 of us, and we get together about every 2 weeks to say, tell me what you're doing about this, tell me what you're doing about that. So this really is the time to reach out to your counterparts, and I'm sure you will find a lot of cooperation. It's been very, very heartwarming and gratifying. These are really complex problems, and as Elaine said, we need to know what we don't know by talking to other people.
So we have another question in the chat, Cheryl, specifically directed at you, but we will open it up then to others who may have comments. It's from Bridget Carney at Feeding America, and she asks, for nonprofits who may not have the funds to integrate some of the kind of innovative approaches that you outlined, what are your recommendations for some budget conscious opportunities to keep this kind of workplace as safe as possible? I don't know if that's something that you looked at, that there was some kind of low-hanging fruit or easy wins for workplaces.
No, I think you can. It's a great question. I think that you can start with, looking at your facility and your space, and how can you, even by pulling out a few chairs out of a room, if you have larger counseling rooms, being able to use those. If they're still smaller counseling rooms, could you afford some type of screening? And I've seen a lot of cost-effective products out there that are able to do that. Hand sanitizer is a must, especially in client areas where maybe sinks aren't necessarily accessible. But it's about spacing things out. More importantly, and this can be done extremely affordably, is signage. And really, the communication that you want is that only 2 people in this area at a time, or I've seen some very thoughtful messaging out there. There are a lot of things that you can do. I'm happy to have a conversation further with you about that. But there are some, as Seth said, some low-hanging fruit, if you will, to try and adapt things in your environment.
This is Elaine. I'll just add on what Cheryl was saying. I worked with my brother, who is a small business, and if you take the guideposts of the bullet points that were shared by others and just think creatively in your own space, just a thought plan around those, you can get very far along in preparing. Simple things is what you heard, but just use these guide points and thought questions to say, what would I do in my space? Get you the 80 for the 20 in many ways.
Well, so I'm going to try to end us on an optimistic note, even amidst all of the challenge that is faced in this pandemic. And the question I have for each of you is, if you could think about one, what we'll call silver lining, which is one major change that's going to be accelerated in this moment that you think may stick into the future and may make us better off than before. And Cheryl, without meaning to put you on the spot, I think there were so many innovative ideas in the workplace that you outlined that are for the future anyway. I'm just curious, maybe if we start with you and then we'll hear from the others if there's one that struck them.
Sure. Everyone that we're talking to, our clients, our internal colleagues, it's really about technology and what technology can do. And I think technology, sometimes people look at a lot of dollar signs associated with that, and not necessarily so. There are a lot of creative solutions out there that can be applied, that with these solutions, you're navigating the space until there is a vaccine, where you're trying not to create densified places, you're trying to de-densify. And you're also trying to create more of a touchless impact, if you will. I mean, when we're looking to the other side of this, this is really about creating healthier environments, period. And what can we do now with technology, voice activation, hand activated, swipe with your swipe phone, swipe with your smartphone. There's a lot of new interesting things that are coming out there, but as was said on this call, there's a lot of new interesting things out there that have yet to be vetted yet. Everyone's tried to come out there with the best thing for you to buy. What we're encouraging our clients to do, and we are doing it with them, that with each new advent of things that we're looking at, we're doing mock-ups, we're doing testing on these things to see if they can be fully vetted and beneficial.
Thank you, Cheryl. Pettis, can we go to you next? Oh, I'm so sorry, Pettis. That is my fault. You are now unmuted.
So I would definitely agree with a lot of what Cheryl said. And I would also say that I think this is going to be a reminder, like I mentioned, around that mission, the second part of that mission of not just focusing on the bottom line, not just focusing on the operational side of things and selling your products and services, but also focusing on health and safety of your employees and customers. And so I think that will definitely go into the future. And so a lot of the changes, operational changes from a technology standpoint and HR policy standpoint, I think will stick around because we've been reminded how important safety is.
Well, and I will say, as someone who studies social responsibility, I've been amazed to learn more about meatpacking plants in this moment and realize, how many of these standards that, would have felt important pre-COVID, are now finally reaching importance and hopefully will continue. Peter.
I can't just think of one optimistic thing. I can think of three. One, group solidarity and strong ties. People are forming, even though we're not together, we are forming stronger ties with one another and community. Second is an office layout thing that has always bothered me. The open office layout and the diminished private space, I think is going to go away, I hope for good. That boiler room style, it causes a lot of interruptions, decreases focus, and people generally don't like or work best in those environments in some research. And then work from home, I hope, can be more institutionalized as a practice that 30% that Cheryl talked about who'd prefer. Can we find a way to accommodate those people and to allow flexibility in the workplace?
Dean Morado.
Yes, I echo everything that's been said. So I'll try to come up with something that's sticky that I hope is health oriented as well. And that's public health infrastructure. I hope the investment that we make in order to be using data and surveillance information, just like we do with others, dashboards, scorecards of business metrics, that we employ those same principles in our health surveillance, and we continue to invest in that. So once we get past COVID, there will be other types of health outbreaks of different forms. And what can we learn from here so we can just be more responsive next time? And an appreciation that our bottom line economics is driven also by our bottom line health. And so I hope that that continues to stay with us.
And Kevin Stevens, our dean, you have our last word here.
Thank you. I think one of the things we've learned is how much we value each other. And I think the organizations that address this crisis openly and transparently and invite the input from as many people as possible, the organizations that treat their employees like they value them are going to come out way, way ahead. There's never been a more important time to have an open, collaborative environment, ironically, in a time when we're self-isolating. The other thing I'll say from a narrower point of view, there was an editorial in the New York Times about how online education is going to replace a face-to-face education. I think that article is exactly wrong. The demise of the university system, I think, has been postponed. Our students really, really want to be in class face-to-face, as do our faculty. That's become crystal clear to us.
Well, and I'll just close by mentioning that in an earlier webinar, we had some extraordinary data from Edelman that we shared, and it affirmed everything that you all just said, which is that in this moment, people's expectation is for business to be putting people ahead of profits, and they truly see the employer now as an even more key part of their lives because this health and wellness function is now more intertwined than ever before. And so hopefully that leads to even greater expectations in the future, and that those expectations are fulfilled, so that to everyone's points, we're seeing people at the center of our economy and of our decision making. Thank you all for being with us. We're enormously grateful to have you, and we look forward to continuing the discussion in the weeks ahead. Bye, everyone.
Thank you all. Thank you.